Well, a myocardial infarction is what happens when a clot forms in the coronary artery and some part of your heart muscle doesn't get enough oxygen. The consequence of a heart attack, as it is called by the public, the consequence is that there is part of your muscle that will disappear, and the consequence in due course is that you will have a less long survival time. The symptoms that may occur during a heart attack are quite typical. The patient will have a nauseous feeling, he will start sweating, he will feel like vomiting, and what you see is that he will become pale, and the slight sweating is also very typical. Of course, the chest pain can occur, but in some instances we even see that silent myocardial infarctions can occur. And a silent myocardial infarction is difficult because the patient doesn't sense anything, but in the meantime, his heart muscle gets damaged. Well, the crucial thing is to act fast. And what we see in daily life is that patients wait too long before they seek help. And one of the funny things is that even patients that had a myocardial infarction before are even amongst the people that act the slowest when they have a second heart attack. I think that the crucial thing is to seek medical assistance as soon as possible so that somebody, or in this instance an interventional cardiologist, can reopen the coronary artery. There is basically there's 5 things that you need to bear in mind. There's 5 major risk factors. Of course, there are smaller ones, but it all bears down to high blood pressure, diabetes, sugar disease, smoking, of course, is a very important one. A family history of heart disease is a very crucial one, and a high cholesterol. These are mainly the 5. Of these 5, there's 4 we can attack and we can change. Of course, the family history is something that is genetic, and we cannot change that. Well, I think it's very important that they attack the risk factors that they are still having. That means that we can, as I said before, we can tackle most of the risk factors. The only thing, of course, that we cannot tackle is the family history of the patient. I think it's very important that they start exercising if they don't on beforehand. And I think that in the future, more and more people are going to take matters into their own hands and using electronics to follow the health of their own heart.